Okay, and I mean, one of the challenges is how do you bring a large-scale change model from a piece of paper to life? And obviously it requires a certain amount of leadership, a certain amount of involvement and engagement of people. But one of the things that we're doing in South Wales, in Heads of the Valleys, is we're in the middle of a large-scale change academy, very, very similar to the one that you headed up all those years ago. Their vision is to get more people more active more often, and they have a compelling story around that, and they've engaged at the moment up to 60 people to come to the academy. At the last academy session we started building a driver diagram, which for me is one of the significant kick-starting tools of the process. What's your thoughts on driver diagrams?
I think driver diagrams are really an essential tool for large-scale change because it allows you to put in one place everything that needs to happen and to get it organized around those key themes that people can get their heads around. Oftentimes the vision is so far out there that people can't quite figure out, well, where do we get started? What do we do? And the driver diagram enables you to capture that. It often, once you put it together for the first time, and stand back from it, you often have the experience of, wow, this is really large. There's lots of lots here, lots to be done, lots of stakeholders to involve.
And I think where we were at as an academy last time was that, wow, I mean, it was a brilliant sea of post-its of what's actually going on and great aspiration of what also needs to happen, which we've discussed this morning. And for me, the challenge is, how do you turn now the driver diagram actually into action? How do we get going? You know, who do we need to now engage and what the process of that is? So we started to talk on stakeholder engagement. What are your thoughts on what great stakeholder engagement should look like and how do you do it?
So the driver diagram often uncovers even more stakeholders than you would imagine to begin with. So a first thing to do, of course, is to kind of stop and take stock. Are the 60 people that you have in the room really representative of the whole of the stakeholders, or do others need to be involved? And it's that framing. You have to then frame the case to involve them. In this case, all you want is just to get the stakeholders to come to become part of this. Then you're not asking them to make a major change in anything, but that's just one of those cycles. Good stakeholder engagement is always a dialogue. It's always here's what we're thinking about doing. What do you think? Here's what we think the needs are. What do you think? And it's that give and take in that dialogue, which takes time. But without it, you go off in a direction that isn't useful, perhaps.
And I think that what's different is the academy gives you a safe space to try those conversations out, but you need to get action going. So we work in 30 and 60, 90 days, because from the work that we understand through the model is you can't predict much further than that, can you? It's what's here and now. Achieve that, move on.
Yes. If it's that 2 steps down thing, isn't it? That if it's going to take us 5 years to get to our vision, then the question is, what can we do in the next 5 weeks? And if you're not thinking like that, if you're thinking, well, this is going to take us 5 years, what you end up doing is 4.5 years later you finally get underway, and then it's too late. So it's really important to get that pace and get that momentum going. You want to take small bite-sized pieces, but you want to have a sense that we're making progress. This is where we were last month, this is where we are this month, and it's a little bit further down the road. It's a long journey, but at least we're moving down the road.
And what you've touched on there is measurement of large-scale change, and I think one of the challenges is how do we measure it? How do we show early success, quick wins, and how do we show change over time?
Yeah, in the early days of a large-scale change effort, the measure of success is often just numbers of stakeholders that are actively engaged in doing something. It's not until there's enough momentum generated that you're able to begin to see some indications that outcomes are going to change. So you go from kind of measures of numbers of people engaged to activity underway to eventually outcomes that you're trying to influence. But if you focus too much on the outcomes to begin with, you lose heart. You think you're not making enough progress. Mm-hmm. Give it time. Have some patience. It'll take time.
And one of the things we were talking about this morning is, I think, quite an exciting opportunity with this academy is the engagement of members of the community, that concurrent investigation with the community who are affected by the harm and need to affect the change as well as social movement. And we talked about the similarity possibly with patient engagement, but actually this is very different, isn't it? Because the compelling reason may not be there for those that we need to engage at the moment.
Yeah, I think you have an order of magnitude more difficult challenge than to say a large-scale change in an acute care setting. So you might say we want to reconfigure maternity services. Yes, you can do that, and you can be fairly certain that there will be women who need maternity services, and they will turn up at the acute care facility. In the challenge that you've got, as I understand it, you could build a lot of facilities. You could build new leisure centers or walking paths. But if nobody's coming to the leisure center, no one's walking on the walking path, it doesn't do much good. So you've got the challenge of getting members of the public to see the need to make a change in their lifestyle. And that's a big challenge. You should be doing lots of work in public engagement and dialogue in this project.
And that's great to hear. And where we're at the moment is we've heard our burning platform reason for coming together, and we've talked about turning it into a burning ambition to drive us forward, to get that momentum. Where would you like to see us going forward in the coming months as an academy and the journey that we're on?
I think the first thing to do is to take stock of the giant driver diagram that you've created and say, is truly everything up there, and can we add more? Do we need to take some things off? Do we have all the stakeholders agreed? But then to turn your attention to engagement of the community, and this has to be an engagement that's more than just a single meeting where a few people turn up and say a few things. It's how do we create the dialogue, an ongoing dialogue? How do we have members of the community being just as active stakeholders as public health professionals and local government people? That's going to be a big challenge for you, but I think that's your next step.
And the academy participants heard a great analogy of how it takes Usain Bolt just under 10 seconds to run 100 metres, and every 10 seconds the NHS and partners spend around about £10,000 on putting the sticking plasters on the harm of physical inactivity, which means as an academy, whilst we're sat there working, it's costing about £25 million per session. And whilst that's a wow factor figure, that's a figure that is unimaginable and so far away from connecting with what we've just talked about. And so we need to work very hard on framing and reframing what that actually means for ourselves, for the academy, for the participants, and for the community. Yeah.
Always be careful of a framing that is a cost framing, and it's true of all framings. Whatever the framing is, it'll attract some people and it'll be meaningless to others. So a cost framed need for change attracts finance directors, attracts politicians, local government who have to manage that cost. But it's a number that doesn't necessarily mean anything to the average member of the public. £25 million. You can't. How do you get your head around that? So having that framing of what does it mean for someone's life? How will their life be better if they take part in physical activity? Finding ways of framing that in ways that engage them and make an attractive case for change rather than a burning platform. I'm not a big fan of burning platforms. I don't want people running away from things. I want people running to things.
Because they're attractive.
They're attractive.
And that's our challenge, which is a good one for you to set. Thank you very much for that. And just before we finish, I've talked a bit about the academy and the enthusiasm of the people that are there and lots of their roles and getting the Academy to see themselves as distributed leaders of change is really important, because this is complex change. It's not complicated, it's complex, and we've talked about that as an Academy. And the enormity of it will need to be shared. And also we need to influence leaders at various levels. So I don't know what your thoughts are to the Academy participants about seeing themselves as distributed leaders and being effective, and their kind of personal passion that's needed around that.
Yeah, when we looked at the case study literature on large-scale change, a thing that almost certainly kills it is when there's only a very small group of leaders and they try to have everything come through them for approvals or those sorts of things. There's just too much work to do for a small number of people. Even though 60 sounds like a lot, I suspect, I haven't seen your driver diagram, but I suspect there's more than 60 people's worth of work to get all that happening. So you have to distribute the leadership. I think it also requires that you rethink what you mean by the word leadership. I think sometimes we think of leadership as either a position of hierarchy, which in this case it doesn't matter where you are in the hierarchy, or we think of leadership as commanding and controlling. And this isn't that sort of leadership. This is leadership that influences. How do you influence others to do what needs to be done? And that skill of influence is the skill of leadership. Whether you're a chief executive or a frontline member of staff, you can influence others, and therefore you can be a leader and be part of the distributed leadership that brings about the change you're trying to make happen.
Okay. Thank you, Paul, for your time this morning. It's been a pleasure to share the journey that we're going on in South Wales across Heads of the Valleys, and I hope you'll watch with interest via Twitter. I know you've done some Twitter engagement with us, which has been fantastic, and I'll look forward to updating you with progress over the coming months, and seeing you soon.
I'm excited to see what you're going to do.